Manhattan is facing a sudden and concerning surge in cases of Legionnaire's disease. The situation is evolving rapidly, demanding immediate attention and a coordinated response from both public health officials and the residents of this vibrant borough. We're seeing an uptick that's beyond the typical seasonal fluctuations, raising serious questions about the underlying causes and potential spread. This isn't just any respiratory illness, it's Legionnaire's disease, a severe and potentially life-threatening form of pneumonia. The disease is caused by Legionella bacteria, which can infect the lungs and lead to serious complications if left untreated. Early diagnosis and treatment are critical to improving patient outcomes and preventing further spread. The rise in cases is putting the city on high alert, triggering emergency protocols and mobilizing resources across various agencies. City officials are convening meetings, strategizing containment measures, and working tirelessly to identify the source of the outbreak. The goal is to act swiftly and decisively to protect the health and safety of all New Yorkers. Health officials, including epidemiologists and public health experts, are racing against the clock to contain the outbreak. They're conducting thorough investigations, tracing the origins of the bacteria, and implementing control measures to prevent further infections. This involves extensive testing of water sources, inspecting cooling towers, and educating the public on preventive measures. While the experts work diligently behind the scenes, public awareness is absolutely crucial in mitigating the spread of Legionnaire's disease. Informed citizens are better equipped to recognize symptoms, seek timely medical attention, and take necessary precautions to protect themselves and their families. Every resident of Manhattan, and indeed the entire city, needs to be aware of and recognize the symptoms associated with Legionnaire's disease. These symptoms can include cough, shortness of breath, fever, muscle aches, and headaches. It's essential to differentiate these symptoms from those of common colds or flu, as early detection is key to effective treatment. It's vital to know how to protect yourselves and your loved ones from this potentially dangerous illness. Simple steps, such as avoiding areas with visible water mist or vapor, especially near cooling towers, can significantly reduce your risk of exposure. Staying informed about the latest public health advisories is also crucial. New cases of Legionnaire's disease are being reported daily, underscoring the urgency of the situation. This constant influx of new infections indicates that the bacteria is not only present, but actively spreading within our environment, posing a continued threat to public health. The ongoing reports clearly show that the bacteria responsible for Legionnaire's disease is actively spreading in our environment. This means it's present in the very air we breathe and the water systems that support our daily lives. Understanding the pathways of transmission is critical to implementing effective control measures. The Department of Health is urgently investigating hundreds of buildings across Manhattan to pinpoint the exact source of the outbreak. This involves meticulous inspections of cooling towers, plumbing systems, and other potential breeding grounds for the Legionella bacteria. The goal is to identify and eliminate the source as quickly as possible to prevent further infections. It's important to remember that Legionnaire's disease is not spread person to person. You cannot contract it through close contact with someone who is already infected. This understanding helps to alleviate unnecessary fear and stigma surrounding the illness. Instead, Legionnaire's disease is contracted through environmental exposure, specifically by inhaling microscopic water droplets contaminated with Legionella bacteria. These droplets can be dispersed through various sources, such as cooling towers, showers, and fountains. The primary culprit in Legionnaire's outbreaks is often contaminated water vapor, particularly from cooling towers associated with large buildings. These towers, which are used to cool air conditioning systems, can become breeding grounds for Legionella bacteria if not properly maintained. Simply being in close proximity to a building with a contaminated cooling tower or other source of Legionella can put you at risk of inhaling the bacteria-laden water vapor. This highlights the importance of identifying and remediating these sources to protect public health. The city has a critical responsibility to eliminate the source of the outbreak and prevent future occurrences. This requires a multi-pronged approach, including rigorous inspections, proactive maintenance of water systems, and swift remediation of any identified sources of contamination. In addition to the city's efforts, the public must remain vigilant and seek medical care immediately if they experience any symptoms suggestive of Legionnaire's disease. Early diagnosis and treatment with antibiotics are crucial to preventing serious complications and ensuring a full recovery. Any delay in seeking medical attention can be dangerous, potentially leading to more severe illness and a longer recovery period. Don't hesitate to consult a doctor if you suspect you may have been exposed to Legionella bacteria and are experiencing relevant symptoms. Legionnaire's disease can progress rapidly, especially in individuals with weakened immune systems or underlying health conditions. In severe cases, it can lead to pneumonia, respiratory failure, and even death. Prompt treatment is essential to prevent these life-threatening complications. This is undoubtedly a time for heightened awareness and proactive measures, but it's equally important to maintain a sense of calm and avoid unnecessary panic. By staying informed, following public health guidelines, and seeking timely medical care when needed, we can effectively manage this situation. By staying informed about the risks, understanding the symptoms, and diligently following the guidance provided by public health officials, we can collectively protect our community from the spread of Legionnaire's disease. Knowledge is power, and informed action is our best defense. The interconnected nature of our city means that a problem in one building or area can quickly affect many others. This underscores the importance of a coordinated and comprehensive approach to addressing the Legionnaire's outbreak, involving collaboration between building owners, city agencies, and the public. A thorough understanding of how Legionnaire's disease spreads, its risk factors, and preventive measures is absolutely key to stopping its further transmission. Education empowers individuals to make informed decisions and take proactive steps to protect their health. Ultimately, your health and the health of your neighbors and the entire Manhattan community depends on the actions we take next. By working together, staying informed, and supporting public health efforts, we can overcome this challenge and ensure a healthier future for all. Legionnaire's disease is a severe and potentially life-threatening form of pneumonia, an infection that inflames the air sacs in one or both lungs. This serious illness demands immediate attention and proper medical care. It's crucial to understand what this disease is and how it can affect your health. Legionnaire's disease is caused by Legionella bacteria, a type of bacteria that thrives in water. These bacteria are rod-shaped and can be found in various water sources. Identifying the source and understanding the nature of these bacteria is key to preventing outbreaks. The good news is that Legionnaire's disease is treatable with antibiotics. Early intervention with appropriate antibiotics can significantly improve the outcome and reduce the risk of complications. However, treatment is most effective if the disease is diagnosed quickly. A rapid and accurate diagnosis is essential for initiating timely treatment and preventing severe health consequences. The sooner the diagnosis, the better the chances of a full recovery. The Legionella bacteria thrive in warm, stagnant water environments. These conditions provide an ideal breeding ground for the bacteria to multiply and increase the risk of infection. This is particularly common in city infrastructure, especially during the hot summer months when water temperatures rise. Urban environments often have complex water systems that can be susceptible to bacterial growth. Legionella becomes dangerous when it multiplies to high levels in man-made water systems. These systems can act as reservoirs for the bacteria, leading to potential outbreaks if not properly maintained. Common sources include cooling towers, which are used in large buildings to cool water. Also, hot water tanks, especially those that are not regularly flushed or maintained, can harbor the bacteria. Decorative fountains, which often have standing water, can also be a source of Legionella. It's important to note that you can't get Legionnaire's disease from drinking contaminated water. The bacteria need to be aerosolized to cause infection. Instead, infection happens by inhaling contaminated mist or vapor containing the Legionella bacteria. This mist can come from various sources, making it crucial to be aware of potential risks. The disease is not contagious from person to person. You cannot catch it by being near someone who has Legionnaire's disease. Only environmental exposure to the bacteria matters. The risk comes from the environment, specifically from water systems that harbor Legionella. Mist or vapor from poorly maintained water systems is the primary way the bacteria spread. Regular maintenance and disinfection are essential to prevent this. Therefore, faulty plumbing and inadequate maintenance are the main culprits behind Legionnaire's outbreaks. Addressing these issues can significantly reduce the risk. Understanding this helps us focus on real risks and implement effective prevention strategies. Public awareness and education are key to minimizing the impact of Legionnaire's disease. This knowledge allows us to address the problem with informed actions, not unnecessary fears. Staying informed and taking appropriate precautions can help protect your health. The threat is primarily in the air, specifically in contaminated water vapor. Being mindful of potential sources of contaminated mist is crucial. So, rest assured, the risk is not in your drinking glass. Focus on the air you breathe and the potential sources of contaminated mist around you. Supporting the efforts of health officials is crucial in preventing and controlling Legionnaire's disease. Their work is essential for protecting public health. Their work to find and clean contaminated sources is essential for safeguarding our communities. By working together, we can minimize the risk of Legionnaire's disease and protect public health. The main culprit in outbreaks is the building cooling tower, not your home AC. These towers cool large buildings by releasing water vapor into the air. If contaminated, this mist can carry Legionella bacteria across neighborhoods. Warm water, poor maintenance, and organic buildup make these towers perfect breeding grounds. Other sources include old plumbing, hot tubs, and decorative fountains that create mist. Home and car AC units are safe. They don't use water in this way. The focus is on large industrial systems that can spread bacteria widely. Strict maintenance and inspections are vital to prevent outbreaks. Anyone can get Legionnaire's disease, but some are at much higher risk. Adults over 50 are most vulnerable, as aging weakens the immune system. Smokers, past or present, face greater danger due to lung damage. People with chronic lung disease, cancer, diabetes, or weakened immune systems are especially susceptible. For these groups, Legionnaires can be life-threatening and progress rapidly. If you're in a high-risk category, be extra vigilant for symptoms. Quick action is critical for those most at risk. Community awareness helps protect our most vulnerable neighbors. Legionnaire's disease often starts like the flu: headache, muscle aches, chills, and high fever. Within days, symptoms can escalate to a persistent cough, shortness of breath, and chest pain. Gastrointestinal issues like nausea or diarrhea and confusion can also occur. These symptoms, especially during an outbreak, are a red flag. Don't wait. Seek medical care immediately if you develop fever, cough, or trouble breathing. Tell your doctor you live or work in Manhattan and mention the outbreak. Early diagnosis and treatment are key to recovery. Recognizing symptoms quickly can save lives. New York City health officials are aggressively tracking and containing the outbreak. Teams are inspecting cooling towers, collecting water samples, and ordering emergency cleanings where needed. Contaminated towers are shut down and disinfected before being restarted. The city enforces strict maintenance laws for cooling towers, with fines for violations. Compliance checks are underway to prevent future outbreaks. Public communication is constant. Press briefings, alerts, and social media updates keep everyone informed. The city's two-pronged approach: eliminate the source and keep the public vigilant. Rapid action and clear information are our best defense. While officials work, you can take steps to reduce your risk. Flush unused faucets and showers in your home. Let hot water run for several minutes in a ventilated room. Avoid standing in mist or steam from buildings or sidewalk grates. Steer clear of decorative fountains or public misters during the outbreak. Focus on avoiding aerosolized water sources, especially if you're high risk. Home and car AC units are safe. Use them to stay cool. Don't let myths distract you from real risks. Staying cool is healthy. The danger is in contaminated water vapor, not air conditioning. Take simple precautions and stay informed. Smart actions protect you and your family. If you develop any symptoms that concern you, it's crucial to act fast and seek medical attention promptly. Don't hesitate or delay, especially if you're experiencing symptoms that are new or worsening. Your health is paramount, and early intervention can make a significant difference in the outcome. When it comes to Legionnaire's disease, time is of the essence. The sooner you receive a diagnosis and begin treatment, the better your chances of a full recovery. Every moment counts, so don't delay in seeking medical care if you suspect you may have contracted the disease. It's easy to dismiss your symptoms as just a common cold or the flu, especially during peak seasons for these illnesses. However, it's important to be vigilant and not automatically assume that's all it is. This is especially important to remember during this outbreak. Increased vigilance is necessary to protect yourself and your community. Stay informed about the latest updates and recommendations from health officials. When you visit your healthcare provider, be sure to inform them that you've recently been in Manhattan. This information is crucial for them to accurately assess your risk and consider Legionnaire's disease as a possible diagnosis. It's also important to specifically mention the ongoing outbreak of Legionnaire's disease. This will further alert your doctor to the possibility of the infection and prompt them to take appropriate action. Providing this information is incredibly helpful, as it guides doctors in ordering the most appropriate and specific tests to determine the cause of your symptoms. Early and accurate diagnosis is key to effective treatment. One such test is a urine antigen test, which can quickly and accurately detect the presence of Legionella bacteria in your system. A chest X-ray may also be necessary to check for pneumonia, which is a common complication of Legionnaire's disease. When Legionnaire's disease is suspected, early testing is paramount. Early testing leads to prompt treatment, which can significantly improve patient outcomes. The primary treatment for Legionnaire's disease involves antibiotics, which are highly effective in combating the infection. Starting antibiotic treatment early improves your chances of recovery and reduces the risk of complications. Certain individuals are considered to be at higher risk of developing severe complications from Legionnaire's disease. These high-risk individuals include those who are over the age of 50, individuals who smoke, and people with underlying chronic illnesses or weakened immune systems. If you fall into any of these high-risk categories, it's even more important to be especially proactive about seeking medical attention if you develop any symptoms. In cases of severe symptoms, it's crucial to seek immediate medical care at the emergency room. Go to the ER if you have severe symptoms such as significant trouble breathing or shortness of breath. Confusion, disorientation, or any other neurological symptoms also warrant immediate emergency room evaluation. Rest assured, New York's hospitals are well prepared and remain on high alert to effectively manage any cases of Legionnaire's disease. Ultimately, your health is your responsibility, and taking prompt action is essential for protecting yourself and others. Don't delay seeking medical attention if you have concerns. Remember, early action saves lives and can significantly improve the outcome of Legionnaire's disease. Manhattan's Legionnaires outbreak is a serious challenge, but we're not powerless. Knowledge and vigilance are our best tools. Understand how the disease spreads, who's at risk, and what symptoms to watch for. Health officials are working hard, but public cooperation is essential. Pay attention to your health and that of vulnerable neighbors. Take simple precautions and avoid unnecessary risks. Recognize symptoms and seek care immediately. Don't hesitate. Early diagnosis and treatment prevent severe illness. Share accurate information and support community efforts. Together, we can protect each other and help